1. What is the primary goal of ergonomics? A. To increase workplace comfort. B. To reduce injury and strain. C. To enhance worker productivity. D. To promote physical fitness. 2. Which of the following is a key principle of ergonomic design? A. Maximizing work duration. B. Minimizing physical strain on workers. C. Encouraging sedentary behavior. D. Eliminating all work-related stress. 3. What does an ergonomic assessment typically aim to identify? A. The average salary of workers. B. Risk factors for musculoskeletal disorders. C. The most effective work schedules. D. The total number of employees. 4. Which of the following is an example of an ergonomic risk factor? A. Excessive force applied to an object. B. Regular breaks for employees. C. Well-designed office chairs. D. Adjustable workstations. 5. Which ergonomic assessment tool is commonly used to evaluate a workstation setup? A. The NIOSH lifting equation. B. RULA, rapid upper limb assessment. C. OSHA injury report. D. Maslach burnout inventory. 6. What is the purpose of using an ergonomic risk factor matrix? A. To evaluate workers' mental health. B. To track the number of office visitors. C. To assess and prioritize ergonomic hazards. D. To calculate employee satisfaction levels. 7. Which of the following is not a primary consideration when designing an ergonomic workstation? A. Posture. B. Lighting. C. Desk color. D. Keyboard positioning. 8. What does the term neutral posture refer to in ergonomics? A. A relaxed stance while walking. B. A position that reduces strain on the body. C. The ideal sitting position for maximum comfort. D. A posture that encourages frequent movement. 9. What is the main purpose of ergonomics in the workplace? A. To eliminate all work-related stress. B. To design equipment that is aesthetically pleasing. C. To reduce the risk of injury and improve worker performance. D. To increase the cost of workplace equipment. 10. Which of the following best describes the role of a certified ergonomics assessment specialist? A. To enforce health and safety regulations. B. To assess work environments for ergonomic risks and recommend improvements. C. To evaluate employees' job satisfaction levels. D. To supervise workers' daily activities. 11. Which of the following is an important factor in preventing repetitive strain injuries (RSIs)? A. Frequent movement and task rotation. B. Extended periods of uninterrupted work. C. Using heavier tools to increase efficiency. D. Lowering workstation heights for all workers. 12. Which muscle group is most commonly affected by poor ergonomic practices? A. Abdominal muscles. B. Upper body muscles, including the shoulders and neck. C. Leg muscles. D. Lower back muscles. 13. Which of the following should be considered when evaluating the height of a desk? A. The distance between the desk and the wall. B. The user's seated elbow height. C. The desk's aesthetic appeal. D. The weight capacity of the desk. 14. What is the primary purpose of implementing ergonomic training programs in the workplace? A. To promote teamwork and collaboration. B. To educate workers on proper posture and movement techniques. C. To increase company revenue. D. To encourage workers to take regular breaks. 15. Which of the following is a common method for reducing repetitive motion injuries in the workplace? A. Implementing job rotation. B. Encouraging workers to work longer shifts. C. Providing more sedentary roles. D. Reducing the number of workstations. 16. What is the first step in conducting an ergonomic assessment? A. Implementing corrective actions immediately. B. Observing workers in their typical work tasks. C. Providing ergonomic tools to workers. D. Conducting a worker satisfaction survey. 17. What is the purpose of the 2-minute rule in ergonomics? A. To ensure that workers take breaks every 2 minutes. B. To reduce the duration of time spent in one posture or task. C. To promote standing every 2 minutes. D. To stretch the muscles every 2 minutes. 18. In ergonomic design, what is the significance of task variety? A. To increase productivity by focusing on a single task. B. To allow workers to perform a range of tasks to prevent strain. C. To minimize worker communication. D. To encourage multitasking. 19. Which of the following types of workers is most at risk for musculoskeletal disorders, MSDs? A. Office workers who sit for long periods. B. Construction workers who lift heavy objects. C. Retail workers who stand for extended periods. D. All of the above. 20. What is the primary focus when designing a ergonomic workstation? A. To increase productivity. B. To minimize physical strain on the worker. C. To make the space more visually appealing. D. To meet environmental regulations. 21. What is an example of a low-cost solution for reducing strain in the workplace? A. Replacing all equipment with ergonomic tools. B. Reorganizing the workstation layout for better access to tools. C. Hiring additional staff for manual labor. D. Increasing work hours to complete tasks faster. 22. Which of the following is a major ergonomic risk factor for office workers? A. Heavy lifting. B. Inadequate seating arrangements. C. Working in a noisy environment. D. Performing complex calculations. 23. What does an ergonomic evaluation typically assess? A. Environmental factors such as noise and temperature. B. The physical design of the workstation and work tasks. C. The effectiveness of employee training. D. None of the above. 24. What is the first step to reducing eye strain in an office setting? A. Reducing screen brightness. B. Taking regular breaks from screen time. C. Positioning the screen at an angle. D. Increasing ambient lighting. 25. What should be the primary focus when evaluating a chair for ergonomic purposes? A. The aesthetic design of the chair. B. Comfort and support for long periods of sitting. C. The chair's adjustability for multiple users. D. The chair's durability. 26. What is task rotation in ergonomic practices? A. Reassigning workers to different jobs to reduce repetitive strain. B. Allowing workers to work fewer hours. C. Ensuring that workers only perform one task all day. D. Providing tasks that require minimal effort. 27. What is the main reason for promoting neutral posture in the workplace? A. To ensure the worker maintains an alert, upright position. B. To reduce strain on muscles and joints. C. To promote standing and walking as much as possible. D. To maintain an aesthetically pleasing office environment. 28. What ergonomic intervention is most effective for workers who perform repetitive motions? A. Offering frequent breaks and task rotation. B. Increasing task duration. C. Encouraging workers to perform tasks in a sedentary position. D. Decreasing work hours without changing task design. 29. Which of the following is a major ergonomic risk factor for office work? A. Heavy lifting. B. Inadequate seating arrangements. C. Working in a noisy environment. D. Performing complex calculations. 30. What should be done after completing an ergonomic assessment in the workplace? A. Provide workers with a financial bonus. B. Implement ergonomic changes and monitor their effectiveness. C. Conduct annual surveys. D. Distribute printed educational materials. 31. Which ergonomic principle should be followed when designing workstations? A. Adjustability to accommodate various body sizes and work styles. B. Using the same furniture for all workers. C. Minimizing the number of furniture pieces in the workspace. D. Standardizing all workstations to one size. 32. How can managers help employees adhere to ergonomic practices? A. By enforcing strict posture requirements. B. By offering financial incentives for correct posture. C. By providing ergonomic training and regular assessments. D. By requiring employees to take long breaks every day. 33. Which of the following ergonomic tools is commonly used to assess workstation setups? A. The NIOSH lifting equation. B. The strain index. C. The rapid upper limb assessment, RULA. D. The work environment risk assessment. 34. What is an example of a task that could benefit from ergonomic redesign? A. Filing paperwork in an office environment. B. Running outdoor errands. C. Cooking meals for the company cafeteria. D. Supervising warehouse workers. 35. What is the benefit of ergonomic interventions in a workplace? A. Reduced injury rates and improved worker productivity. B. Increased company profits through higher worker satisfaction. C. Aesthetic improvements in the office design. D. Improved team collaboration. 36. What should be the first step in assessing a worker's ergonomic needs? A. Conducting a safety audit. B. Observing the worker in their typical work tasks. C. Providing all workers with ergonomic furniture. D. Conducting a worker satisfaction survey. 37. Which factor is critical in ergonomically designing a computer workstation? A. Ensuring workers have a high-speed internet connection. B. Organizing work tools for efficiency. C. Designing for long periods of standing. D. Ensuring the workstation promotes neutral body posture. 38. What does the acronym NIEHS stand for in relation to ergonomics? A. National Institute for Environmental Health Sciences. B. National Ergonomics and Industrial Safety Hub. C. New Ergonomic Innovations for Healthy Science. D. None of the above. 39. What is the primary function of ergonomic chairs in office environments? A. To provide comfort while sitting for extended periods. B. To enhance office aesthetics. C. To make workstations look more professional. D. To minimize noise during meetings.